probably know that various types of cells link together to make up the many tissues of the body. And different tissues combine to form organs. When it comes to muscle tissue, there are basically three types: cardiac muscle, smooth muscle, and skeletal muscle. These are differentiated by their microscopic structure, which we don't cover in a gross anatomy course, since gross in this sense means able to be seen with the naked eye. But the three types of muscle are also differentiated by whether we can voluntarily control them or not. And this corresponds to their relationship with the nervous system. In fact, we have distinct divisions of the nervous system related to the control of voluntary muscle versus the subconscious control of involuntary muscle. So, for example, cardiac muscle is only found in the heart. It makes up the walls of the heart chambers and is one of our two types of involuntary muscle. That means that we cannot control its action directly. Sure, we can increase our physical activity level, and that will cause the heart to beat faster and with more force, but that's indirect control. When an unfortunate person is suffering from atrial fibrillation or maybe a heart attack, he or she cannot will their heart back into rhythm or make it start beating again. The name smooth muscle is due to the internal appearance of the cells in this type of muscle, but it is also involuntary muscle that we cannot consciously control. Smooth muscle is typically found in the walls of hollow organs like the stomach, the bladder, the uterus, and the walls of blood vessels. But it's also found in other locations, like the tiny muscles in the skin that give us goosebumps, or in the iris of the eye to cause the pupil to dilate or constrict. And as with cardiac muscle, we can do things that affect smooth muscle, like eat food that will cause the stomach to churn, but we can't voluntarily make smooth muscle operate or stop contracting. Remember that the next time you're in a business meeting or on a date and your stomach makes all kinds of crazy noises and you sit there wishing you could stop it. The third kind of muscle tissue, and really the only type that's directly relevant to this course, is known as skeletal muscle. It is given that name because of its general ability to move the bones of the skeleton through its attachments. And as I'm sure you realize, this is our voluntary muscle tissue, subject to our conscious control. With that said, we can develop what's become more or less subconscious patterns of muscle action, sometimes called muscle memory, like knowing how to swing a tennis racket, throw a ball, drive a car, or perform a particular dance routine without really thinking about it. Even our postural muscles, like those in our back, well, we don't have to constantly tell them to keep our spine straight. However, if your grandma or a drill sergeant told you to stand up straight, you could certainly voluntarily fix that posture. And then there's the whole notion of reflexes, which are involuntary movements that include some within our skeletal muscles. These encompass a few innate reflexes and plenty of learned reflexes. An example of an innate reflex is the grasping reflex. If something like a finger is placed in a newborn infant's palm, they will close their fist around it. We share this reflex with most of our fellow primates. Other reflexes are protective actions. For instance, if someone throws a ball and it looks like it's going to hit you in the face, you will reflexively bring up your hands to protect yourself. That's a learned reflex, and as a result, you wouldn't think of doing that to a baby. Likewise, if you touch a hot stove, your skeletal muscles will automatically execute what's called a withdrawal reflex and pull your hand away before you even know it, and before you even have a chance to say ouch or something more colorful. So from these examples, we see that even our voluntary skeletal muscles have some involuntary overrides. As a tissue, skeletal muscle has several major functions. Now, body part movement is an obvious function, but not all skeletal muscle movements are as plain to see, such as our more subtle movements like breathing and the voluntary phase at the start of swallowing. Skeletal muscle movements are also used in our communication, whether through speech and handwriting or through nonverbal communication, with our facial expressions and body language. Though cardiac and smooth muscle also cause movements, those are more internal and are typically not obvious from the body's surface, with a few exceptions like goosebumps or the dilation and constriction of the pupil. Additionally, we can feel and hear the heartbeat and sometimes our stomach churning. By contrast, some of our stillness also comes from muscle contraction, like the postural muscles that keep our spine erect or our legs straight when we're standing. Skeletal muscles that surround joints can also hold fast to help stabilize those joints. This is because skeletal muscle can contract and generate force without actually causing movement. Imagine yourself really upset about something and tightening up all your muscles in your upper limbs, for instance, without actually moving any body parts. In addition, skeletal muscle sphincters govern the outlets of the urinary and digestive systems. In each case, there's a smooth muscle sphincter that is more internal and a voluntary skeletal muscle sphincter that is more external. When the bladder or bowel is full, the involuntary sphincter will relax, but when we were potty trained, we developed learned voluntary control over the external sphincters, which will help us stall elimination until we get to the right time and place. And as I tell my physician assistant and physical therapy students, your patients want to retain that voluntary control just as you do, since without it, people become incontinent and lose control over bladder or bowel functions. A lesser-known role of skeletal muscle tissue is in heat production. As much as about 85% of our normal body heat, or roughly 98.6 degrees, is due to the action of skeletal muscles. The reactions that occur within the muscles generate heat as a byproduct. This is why we get hot when we exercise vigorously and why we sweat to dissipate some of that body heat. And maybe like me, you remember waiting at a cold bus stop as a kid, jumping up and down and rubbing your arms to generate some extra heat from the friction. Maybe we didn't know why it worked, but it did help us stay warm. Lastly, in terms of physiology, skeletal muscle activity helps regulate glycemic control. In other words, exercise is good for the proper maintenance of blood sugar. Muscle action doesn't just use up glucose, which is the transport form of sugar in the blood. Cells need insulin to take up and utilize the glucose from the blood. Scientific research shows that regular exercise can improve the body's use of and sensitivity to insulin. Of course, if someone is diabetic, all this should be checked with a physician, since anyone taking insulin could have their blood sugar lowered too much during exercise when the muscles begin to utilize the blood sugar for their metabolism. Now, let's get back to anatomy. References usually quote between 600 and 800 muscles in the body. I've never tried to count them myself, plus some are repeating themes like the muscles between the ribs, so the total number depends on how those are counted, I guess. Moreover, each muscle is considered an individual organ, since organs are composed of multiple tissue types. Skeletal muscle tissue qualifies because it also has some connective tissues within it to help it work and give it more stability. Those connective tissues become one with the tendons at either end of a muscle. Or you could say that the tendons that connect muscle to bone don't disappear. They spread out throughout the muscle and compartmentalize it into bundles of related muscle cells that act as a unit. The packing of muscle cells into groups, called fascicles, gives skeletal muscle a grain, if you will, a striated appearance of directionality that we'll see is very helpful in understanding a muscle's action. Muscles do come in different shapes and sizes, and those shapes not only have names, but also relate to the action of that muscle. Muscles and the cells within them shorten to execute movement. So the ability to see the directionality or grain within a muscle is key to understanding how it acts on the bones it's connected to. More on that as we go. But suffice it to say that because all muscles aren't shaped the same way, they don't all function in the same way, since, as I've said, in anatomy, structure determines function. In order to understand how muscles work on the gross level, we also need to consider their attachments. Generally, each muscle has a tendon of attachment at either end, and the fleshy mass between the two is called the muscle's belly. So let's consider a typical fusiform muscle. That means one that tapers at both ends, like the biceps brachii of the arm. The tendon of attachment to the bone that the muscle does not move is called the muscle's origin. The tendon of attachment to the bone that the muscle moves is known as its insertion. In the case of the biceps brachii, there are actually two origins, as the bi of its name implies. It's a two-headed or two-bellied muscle. It has what's known as a long head and a short head, and the origins of both of those are on the scapula. Now, saying that those are the origins of the biceps brachii doesn't mean that the scapula cannot move. It just means that moving the scapula is not the job of the biceps brachii. That's some other muscle's job. And as we'll actually see, not just one muscle, there are many muscles that act on the scapula. Now, the tendon of insertion for the biceps brachii attaches to the radius in the forearm. And although the biceps brachii crosses both the shoulder joint and the elbow joint, its main role is to flex the elbow. Since the biceps brachii crosses the front of the elbow, and given muscles shorten to cause movement, I tell my students to think of muscles like puppet strings. If the biceps brachii passes anterior to the elbow joint and inserts on the radius just distal to the elbow joint, it will flex the elbow. Knowing where a muscle is relative to a joint is key to knowing its action, especially when the grain of that muscle is considered. But the biceps brachii is not the only muscle that flexes the elbow. There's another muscle lying deeper than the biceps brachii called the brachialis. The brachialis originates on the humerus by a broad, flat attachment along the anterior surface of the humerus, more so than a defined tendon, and it inserts on the ulna of the forearm. So, to review, is its job to move the humerus where it originates or the ulna where it inserts? Right, moving the ulna is its role. When we flex the elbow, the brachialis actually does more of the work than the biceps brachii due to the positioning of its attachments. But the biceps often gets more credit since it's more superficial and pumps up beneath the skin due to its fusiform shape. So it's not just the shape or grain of a muscle, but its attachment position relative to the joint that matters. And all are part of the leverage systems that I mentioned in an earlier lesson. Now remember that joint movements have partners. Flexion of the elbow is bending it, and we've seen that the biceps brachii and brachialis work together to do that. So which muscle extends the elbow? The triceps brachii is in the posterior arm, and as you may have guessed from the prefix tri, it has three bellies, or three heads, as they are often called. One of the three heads originates on the scapula, while the other two originate on the humerus by broad, flat attachments, like the brachialis has, rather than a visible tendon. So the job of the triceps brachii is not to move either the scapula or the humerus. Triceps brachii inserts on the olecranon process of the ulna, that pointy prominence on the back of your elbow. Because the triceps inserts on the ulna, its job is to move the ulna. And because it's positioned posterior to the elbow joint, by that puppet string logic, the triceps brachii functions to extend the elbow. Now, our job right now is not to study these specific muscles, but to use them to illustrate some basic principles of muscle shape, position, and attachments. And here we should also talk about how muscles work in groups. The main muscle that causes a given action is called the prime mover or agonist for that action. And a muscle that assists in a given action is termed the synergist for that movement. A muscle that must relax in order for a prime mover and its synergist to act is called the antagonist to the given movement. So in our example, the prime mover for flexion of the elbow is the brachialis, and the biceps brachii is its synergist or its assistant. The triceps brachii must relax in order for elbow flexion to occur. So it is the antagonist in elbow flexion. On the other hand, no pun intended, if we discuss extension of the elbow, then the roles reverse, and the triceps brachii becomes the prime mover, and the biceps brachii and brachialis must relax. So those two muscles now become the antagonists to triceps brachii. I should mention that the antagonist's role is not just in relaxing. It also helps prevent injury by not allowing excessive action of the prime mover. As we'll see throughout the course, antagonistic pairs often flank either side of the joint they move, and an understanding of origins and insertions is crucial to understanding muscle action. One final role I should mention with regard to functional categories in muscle action is that of a muscle acting as a fixator or stabilizer. A fixator in a given action is a muscle that holds a bone in position so another muscle can act. Good examples of this are seen at the scapula, which is such a freewheeling mobile bone. There are several muscles around the scapula that insert on it to help hold it in place so that the other muscles that originate on the scapula can do their job of moving the humerus, for instance. And not to complicate things too much early on, but some muscles don't even insert on a bone. Some insert on each other or even on the skin, as we'll later see. A couple of other principles come to mind that should probably be mentioned here. Not all references use the terms origin and insertion. Some sources use superior and inferior attachment, or for other muscles, proximal and distal attachment. This is because the role of a given muscle can change depending on body position. For example, if you bend over and touch your toes, you're using a muscle of the anterior abdominal wall called the rectus abdominis. And as you lean over, you're bringing your sternum and rib cage closer to your pelvis. So using the origin and insertion terminology, the pelvis is the origin for the rectus abdominis, and the sternum and rib cage are its insertion. But what if you're lying on the floor and bringing your pelvis toward your rib cage like in a pelvic curl exercise? Then does the pelvis become the insertion and the rib cage become the origin? To avoid having such role reversal for a single muscle, some sources use superior and inferior attachment, which works in either position, standing or lying, since anatomical position locks these directions in. The problem, however, is this terminology doesn't help you understand the normal or typical function of the muscle, which attachment stays stationary when the muscle contracts versus which is the bone it works to move. That's why I like and use origin and insertion. I will add this isn't a problem when it comes to limb muscles, and I'll remind you of this throughout the course, because the origin of a limb muscle is always proximal and its insertion is always distal. This might also be a good time to use biceps brachii and triceps brachii to reinforce what I call the rule of adjectives, and to give a general introduction to how muscles are named. The brachium is the arm region between shoulder and elbow, so that informs us of the muscle's location. And the pairing of the adjectives triceps and biceps also tells us that one has two heads or two bellies and the other has three. But of course, not all muscles are named that way. Muscles are also named for the direction of their cells, and as a result, the direction of their fascicles or their grain. For example, the external oblique is an abdominal wall muscle with obliquely oriented fibers. And the orbicularis oris is a circular or orb-shaped muscle around the mouth, as in oral. We'll also see examples in which muscles are named for their relative size, like gluteus maximus and gluteus minimus, or pectoralis major and pectoralis minor. Again, these are some helpful adjective pairings that give the size of two closely associated muscles. Sometimes, though, a single adjective is used for two different body regions, as with biceps brachii of the arm and biceps femoris of the thigh. Some muscles are named for their shape, like the deltoid of the shoulder, which is relatively triangular shaped, like the Greek letter delta. But I have to say, among my favorite are muscles named for their action, like the levator scapulae, which elevates the scapula, or the erector spinae, a group of postural muscles that keep the spine extended. My students and I also have a soft spot for muscles named for their origin and insertion, like the sternocleidomastoid, named for its attachments to the sternum, clavicle, and mastoid process behind the ear. A few more details of physiology so we can better understand muscle actions. Do muscles have to shorten to generate force? The answer is no. They must contract and generate tension, but they don't necessarily have to shorten, nor does that force have to cause movement. Remember the principle of bones acting as levers, with joints as fulcrums and muscles as sources of effort or force? Now imagine stretching out your upper limb in front of you and someone putting a heavy book in that hand. To support that increased weight, the muscles of your upper limb will have to generate additional tension and force, but in doing so, the muscles do not shorten, nor do the joints of your arm move. The muscles are contracting, but this type of contraction is known as an isometric contraction. Iso means equal or same, and metric refers to measurement. So the muscle contracts but stays the same length. The other type of muscle contraction is known as an isotonic contraction, which translates to maintaining the same tension, but that terminology isn't exactly accurate. An isotonic contraction is made up of two phases, a concentric phase and an eccentric phase. When a muscle is actively shortening to generate force and move an object, that's a concentric contraction, like lifting a weight by flexing the elbow. But putting that weight down also requires the muscle to do work. In fact, it's even harder on the muscle, and that's called an eccentric contraction. To set the weight down after lifting it, flexors of the elbow still have to be active and in control, but the muscle is contracting while it's lengthening. As I said, this phase of an isotonic contraction is really hard on muscles and more likely to cause injury than the concentric part of the isotonic contraction. A great example of this is when Olympic weightlifters do a clean and jerk. They lift a huge weight to their chest and then push it up above their head. But to avoid injury, they drop the weight rather than putting it back down, which is understandable, but the noise can still make you cringe at the gym. And when muscles are activated to produce force, whether for movement or for support, they require energy, which means muscle cells must have the necessary oxygen and nutrients to produce that energy. To facilitate this, muscles have a rich blood supply to bring those needed ingredients to their cells. Larger arteries, which are named within the body, lead to smaller unnamed vessels called arterioles that move the oxygen and nutrients into the muscle tissue. These arterioles divide into smaller and smaller vessels, such that muscles are completely permeated with a vast network of microscopic blood vessels known as capillary beds. These are thin-walled enough to allow for nutrient and gas exchange between the blood and the muscle cells. Now, small veins called venules leave these capillary beds, taking with them the toxic waste gas known as carbon dioxide that's generated by cells at work, while also removing other metabolic wastes, as well as some of the heat the muscles generate. These venules converge to form larger veins, which ultimately lead back to the heart. The heart pumps that blood to the lungs to release some of the carbon dioxide and pick up more oxygen. And the flow of blood through the kidneys helps remove some of the metabolic waste. The heat is distributed as well, and sweat glands in the skin can take that heat from veins near the body's surface and evaporate it to cool the body during muscle activity. In addition to blood vessels, nerves also connect to skeletal muscles and send signals to their cells. We'll look at the interactions of the nervous system and body muscles in the next lesson. In lessons to come, we'll also see that limb muscles in particular are surrounded by long sleeves or stockings of connective tissue. And then within that sleeve or stocking, the muscles are compartmentalized into groups by dense sheets of connective tissue, generically called fascia. And these dive down among the muscles, separating them into groups. When we get to the specific coverage of the upper and lower limbs, we'll see that these compartments contain groups of muscles that often have similar functions and a common nerve supply. The connective tissues between muscles also serve as planes in which the blood vessels and nerves travel. In addition, this compartmentalization aids in learning the different muscles as functional groups, and it facilitates dissection in the cadaver lab, since these connective tissues partition groups of muscles from each other. The downside of these compartments are the so-called compartment syndromes that can result when the pressure within a compartment of limb muscles builds, compressing them as well as their important blood and nerve supply. Another detail related to limb musculature is the notion of intrinsic muscles. These are muscles that have their entire mass within a body part, like intrinsic muscles of the hands or of the feet. These have their proximal origin, belly, and distal insertion completely in the hand or foot, so their entire action is also within that body part. In contrast, we'll see many muscles in the forearm, for instance, that act on the thumb or the fingers. Those muscles are extrinsic to the hand, as their origins and bellies are proximal to the hand, but they send their tendons distally into the hand. And while a muscle must cross a joint to move it, some muscles cross multiple joints, so can act on all of them. For example, while some forearm muscles insert on the fingers, because they must cross the wrist and joints of the hand to reach those fingers, they also act on the other joints they cross. Well, let's finish up by talking about some learning strategies for the many muscles of the body. I assume you have an interest in that, or you wouldn't be drawn to this course. Examining images is so helpful, especially isolated images of a muscle that include its origin and its insertion. Since muscles shorten to affect movement, seeing the points of attachment and the grain or directionality of the muscle's fascicles really helps to reinforce the action of a muscle in that puppet string manner I mentioned. I also recommend you palpate the muscle on yourself, do the action, and feel the muscle develop tension, perhaps while saying its name. Learning the meaning of the terminology used in muscle naming can also be very helpful. How deep you want to go is up to you, of course. No matter what approach you take, I'm sure you'll come away with a new appreciation for your remarkable body and how it works.